Did you know that breastfeeding offers significant protection against RSV for infants? Hi, I'm Dr. Brittany Todd, and I'm a pharmacist. So there are 3 ways to protect for RSV. The first way is vaccination during pregnancy. Now, how effective is receiving a Breastfeeding, that's the RSV vaccine, during pregnancy? It decreases severe RSV infections by about 20 to 30% in infants up to 6 months old. But there are side effects. The mom has a significantly higher risk of severe and life-threatening adverse events. And one study showed that the RSV vaccine increased the risk of preterm labor and neonatal mortality, and that study was actually stopped because of those safety flags. Now, the one that is currently approved, a Breastfeeding, does not have those safety flags, but it is something to consider in the back of your mind as a mother should you receive the RSV vaccine risk-benefit. The second way to protect against RSV is giving the monoclonal antibody, which is not actually a vaccine, to an infant. And that reduces the risk of RSV infection as well as severe RSV by about 75 to 85% within the first 6 months of getting the vaccine. Again, there's risks that come with taking a vaccine. More infants in the monoclonal antibody group had more serious adverse reactions compared to placebo. In fact, there were no serious adverse events in the placebo group at all. Infantile spasms and facial bruising was a risk of getting the RSV monoclonal antibody as an infant. None of the vaccines or monoclonal antibodies have ever been shown to reduce mortality from RSV in babies. And the third way to protect against RSV is breastfeeding. No side effects. Meta-analyses of multiple studies have shown consistently that breastfeeding reduces the risk of severe RSV infection by about 80%. It also reduces hospitalizations, it reduces need for oxygen and need for ventilation. There has never been a study that compares the RSV vaccine during pregnancy, the monoclonal antibody in an infant, or nursing, but they all seem to be pretty effective. But for me, there's one that is just as effective, but has 0 risk. So if you're a new mom or you're pregnant and you're considering protection for your baby from RSV this season, I suggest you look into the data because you can get a vaccine or a monoclonal antibody, or you can nurse. Same protection rates apply to all 3. One just doesn't have any side effects.